Hiya, welcome to Dr. Chan's Minor Ailments Forum today. As you can see, the weather is really good today, so I thought I'll take the opportunity to kind of soak up the sun ray, getting my vitamin D dose. But while I'm sitting and soaking up the rays, I've been thinking, well, it's probably good to talk about two things. Later on, I'll talk about sunstroke, and secondly, right now I'm going to talk about a syndrome called SAD syndrome, SAD, which is short for seasonal affective disorder. So what does it actually mean? You might hear people saying, especially in the wintertime, they said, oh, I think I've got SAD syndrome. What it actually means is similar to depression. These patients during the wintertime, starting from maybe autumn, when the days getting shorter and shorter, they don't feel like doing anything, lethargic, no mood, and sleep all the time, that kind of thing. So it's very similar to depression, but the only difference is they feel like that during the winter time, and when the sun comes out again, when the weather is really good, they tend to be all right. So I think that's the difference between true depression and SAD syndrome. They're still depressed, but it's mainly affected by sunlight. So how does it come about? It's worth talking about the background of SAD syndrome, really. So what causes SAD syndrome? Well, to be honest, not too many people know why. There's some theory out there saying that the sun does something strange to our brain, which is the part that's really affected is called a hypothalamus, and it's basically control our circadian rhythm and also controlling our appetite and sleep and mood and something like that. So when there's no sun, you can imagine that there'll be less production of serotonin, which is controlled by the hypothalamus as well. So that could be the reason why in some people they're particularly affected. So the treatment option, well, actually, it's very simple. You're replacing what they're not getting, which is the light. So there's some treatment out there called a light therapy. So basically, you buy a light box and put it in your home. And basically, if you sit in front of it, it's really bright light, and that will help you to absorb the light that you're not getting in the wintertime. As you can imagine, wintertime in England is rather gloomy sometimes, and sometimes the light box might not do the trick, and you might need to be on antidepressant. And also cognitive behavioral therapy is also useful. So if you feel that you're particularly low in the winter time and you really have got no motivation to do anything, it's probably worth coming to see your GP to have a chat and see whether you're suffering from, number one, depression, or maybe two, you're low in vitamin D. That can also make you feel pretty tired as well. And if a SAD syndrome is diagnosed, then obviously treatment is available, and that will make you feel a lot better. So I hope that this short video is useful for you, and make sure you go and see your GP to have a chat if you've got any queries. Okay, take care for now. Bye bye.